All right, let's talk about that feeling. You wake up and your neck is so stiff you can barely turn your head. If that sounds familiar, you are in exactly the right place. In this quick explainer, we are going to break down how to fix that sleep-related neck pain. And I'll tell you right now, it's not about magic pillows, it's all about simple mechanics.
Oh man, does this hit home or what? That middle of the night battle with your pillow, just desperately trying to get comfortable? It's something pretty much all of us have done. But the good news is, the solution isn't about finding that one mythical perfect pillow, it's about understanding your setup.
So, let's zoom in on that moment, that 2 a.m. pillow flip. That's not a sign that you're just a bad sleeper or that something's wrong with you. No, it's actually your body sending you a super clear signal that something in your sleep environment just isn't working for it. And this, right here, gets to the absolute heart of the problem. Most of the time, this kind of neck pain isn't some deep, complex mystery. It's just mechanical. I want you to think of your head like a bowling ball. Seriously, for 8 hours a night, that bowling ball is resting on your pillow. If that setup is even a little bit off, of course you're going to feel it in the morning.
So that brings us to the big question, right? If it's a mechanical problem, there has to be a mechanical rule to fix it. And you'd be right, there is. And it's simple, it's super effective, and honestly, it's the foundation for everything else we're about to cover.
And that rule is what we call the neutral neck rule. This is it. This is the one principle that, once you really get it, changes the whole game. It's basically your key to unlocking a pain-free night.
It's so simple. Your nose should point straight ahead. Doesn't matter if you're on your side or your back. Your neck should just feel, well, long and relaxed. It shouldn't feel scrunched up or hanging down or cranked to one side. That's the goal. But, how can you be sure you've actually got it right?
Well, there's a really simple way to check. Tonight, when you lie down, just try to slide 2 fingers into that little gap between your neck and the pillow. If it's a super tight squeeze, your pillow's probably too high. And if you can easily fit, say, 4 fingers in there, it's almost certainly too low. You're looking for that Goldilocks zone with just enough support to gently fill that space.
Okay, so you've got the rule and you've got the test. Now let's put it into action. Your perfect setup is going to look a little different depending on whether you're a side, back, or, yes, even a stomach sleeper.
For all you side sleepers out there, listen up. Your shoulder alignment is just as critical as your neck. Here's a great trick. Hug a pillow. It actually stops your top shoulder from rolling forward and twisting your spine all night. And remember, be patient. Make tiny little adjustments, like adding a folded towel under your pillow, and give your body at least a couple of nights to get used to it before you decide if it's working.
Now, if you're a back sleeper, the biggest mistake people make is the chin tuck. When a pillow is so high it shoves your chin down towards your chest. The goal is to support the natural curve of your neck, not to flatten it out. And here's a pro tip for you. A small pillow under your knees can work wonders. It relaxes your lower back, which takes a surprising amount of strain off your entire spine, including your neck.
All right, stomach sleepers, let's have an honest chat. This position is, by far, the toughest on your neck, mainly because your head has to be cranked to one side for hours. So the goal here isn't really perfection. It's what we call harm reduction. Try using a very, very thin pillow, or maybe even no pillow at all for your head. Then place another thin pillow under your pelvis to take some of the strain off your spine.
Okay, now let's talk about the tools of the trade, the pillows themselves. We've all seen the fancy marketing and the promises of a perfect night's sleep, but what actually works? Well, the answer has a lot more to do with how the material behaves than any brand name.
The number one most important factor here is shape retention. That super soft, fluffy down pillow might feel amazing for the first 5 minutes, but by 3 a.m., it's collapsed into a pancake and your neck support is gone. The best materials, things like adjustable fill or latex, hold their shape and give you consistent support all night long. That's why having a pillow you can customize is often the biggest win of all.
Now, price doesn't always equal quality, but you can see a pattern here. Sure, you can grab a cheap pillow, but investing just a little more in something that's adjustable or made of latex often pays off big time. Why? Because it gives you the control to dial in that perfect neutral setup for your body. You're buying a system, not just a product.
I absolutely love this quote from the source material. It just gets to the heart of it so perfectly. You're not chasing some impossible, mythical, perfect sleep posture. You are just trying to create a calm, supportive space where your body can finally stop fighting against a bad setup and actually truly rest.
So, even with the best setup in the world, you might still wake up with a little bit of stiffness sometimes. And that's okay. It's normal. The real key is how you handle it.
So let's look at a quick morning reset to get your day started on the right foot.
The goal here is gentle movement, okay? Not aggressive stretching. Think of it more like you're just waking up those muscles and telling your nervous system, hey, everything is safe, we're okay. Slow nods, some easy shoulder rolls, a nice doorway stretch. These simple little moves can make a world of difference in how you feel for the rest of the day.
Now, this is incredibly important, so please listen closely. While most morning neck stiffness is mechanical and can be fixed with these tips, some symptoms are absolute red flags. If you're experiencing things like weakness in your arm, numbness that's getting worse, severe headaches, or pain that radiates down your arm all day, it is time to stop experimenting and see a clinician. Don't try to sleep these off.
So there you have it. That's the playbook for a better night's sleep and a happier neck. You get the neutral neck roll, you have the 2-finger test, and you know how to set up your position. So the only real question left is, what's the first small change you're going to make tonight?